Now we will see respiratory volumes and capacities. What does it mean? Respiratory volume and capacities. That means they are volumes of lungs or capacities of lungs, how much that lung part or lung can hold air. How much is it volume or capacity? Okay. On an average, a healthy human adult breathes about 12 to 16 times a minute. Every minute, how much times we breathe? 12 to 16 times average. The volume of air involved in breathing movements can be estimated by using an instrument known as spirometer. Now we breathe 12 to 16 times per minute. Then we should record it, how much we are breathing. For that, how much air we are breathing, quantity, that quantity is measured by spirometer. That instrument is known as spirometer. This instrument helps in clinical assessment of pulmonary functions. Means what? If a patient is breathing less or more or less air is taken in, for that spirometer is helpful. Or any lung capacity problems, any related to tuberculosis, pulmonary edema, in such cases spirometer helps to judge how much exactly the person is breathing, how much quantity. The quantity of air the lungs can receive, hold, or expel under different conditions are called respiratory or pulmonary volumes. What is respiratory volume? The quantity of air the lung can receive, hold, expel. Receive, hold, and expel under different conditions. These are respiratory volumes. Combination of two or more pulmonary volumes are called respiratory capacities. Combination of two or more volumes are called capacities. The inspiratory volume, expiratory volume, how much you can hold that volume. Two volumes or two or more volumes make one capacity. For example, tidal volume. What is tidal volume? It is the volume of air inspired or expired during normal breathing in relaxed or resting position. When we are relaxed or resting position, how much we breathe in or out, that volume is tidal volume, which is approximately 500 ml of air. It consists of 150 ml of dead space. Means what? 150 ml the lung keeps for himself. It doesn't empty full. And 350 ml of alveolar volume. Alveolar means this is in alveolar. 350 ml of air is in alveolar. A healthy man can inspire or expire approximately 6000 to 8000 ml of air per minute. Tidal volume is 500 is equal to 150 dead space plus 350 alveolar volume. Okay. Then inspiratory reserve volume. It is the additional amount of air that can be inspired forcefully after normal inspiration. It is about 2500 to 3000 ml of air. Now you inspire normal inspiration. Take a breath. And now forcefully inspire more. That more inspiration amount is inspiratory reserve volume. That means the lungs has the capacity to take more, but he is taking only tidal volume. that extra inspiratory reserve volume the lungs can sustain is 2000 to 3000, 2500 to 3000 ml of air. That is more of tidal volume. And now same as expiratory reserve volume. It is the additional volume of air that can be expired forcefully after a normal expiration is about 1000 to 11,000 ml. That means extra air we can expire. That is expiratory reserve volume. Now the residual volume RV. It is the volume of air remaining in the lungs even after a forceful expiration. It is about 1100 to 1200 ml. It cannot be measured by spirometry. Various pulmonary capacities are derived from the combination of above volumes. These help in the clinical diagnosis of functioning of lungs. Now, the first one, inspiratory capacity IC. It is the total volume of air a person can inspire after a normal expiration. Means a total volume of air a person can inspire after a normal expiration. How much a person can inspire? Normal it is in relaxed position, it is tidal volume 500, and extra he can inspire, no, inspiratory reserve volume. It is about 2500 to 3000 ml. It includes tidal volume and inspiratory reserve volume. How much you can inspire forcefully? Tidal volume plus inspiratory reserve volume. Next is expiratory capacity. How much is the expiratory capacity? How to calculate? The normal you can breathe out plus forcefully how much you can breathe out. That is expiratory capacity. It is the total volume of air the person can expire after a normal inspiration. It includes tidal volume and expiratory reserve volume. Now the functional residual capacity FRC. It is the volume of air that will remain in the lungs after a normal expiration. It includes residual volume and expiratory reserve volume. In functional residual capacity, you are normal expiring. Okay. So, how much capacity the lungs hold after normal expiration? That is your reserve volume, residual volume plus expiratory reserve volume, which you are going to forcefully expire, and still the lung holds some capacity. Got it? That volume is functional residual capacity. Very important, vital capacity VC. It is the maximum volume of air a person can breathe in after a forceful expiration, or the maximum volume of air a person can breathe out after forced inspiration. If you forcefully inspire, after that how much you expire? Or if you forcefully expire, then how much forcefully you inspire? That is vital capacity. Means how much capacity your lungs holds if there is forceful breathing. Think of pranayam. Forceful inspiration, then how much normal expire, and if you forcefully expire, how much normal you inspire. That much, how much air you need after expiration, how much air your lungs need. Or after forceful inspiration, how much your lungs wants to throw out that extra air. That is vital capacity. It includes tidal volume plus inspiratory reserve volume plus expiratory reserve volume. It varies from 3,400 to 4,800 ml depending upon age, sex and height. Why this is there? Depending upon depending upon the size of lungs, the inspiration capacity, expiration capacity. Next is total lung capacity. It is the total volume of air present in the lung after a forced inspiration. Total volume of air present in air after a forced inspiration. It includes respiratory or residual volume, expiratory reserve volume, then tidal volume, inspiratory reserve volume and or VC plus RV, vital capacity plus residual volume. So what is total lung capacity? How much your lung can hold air? First is residual volume. Then how much it can breathe out? Expiratory reserve volume. Then the tidal volume, how much the air coming in normally coming out, plus inspiratory reserve volume or vital capacity plus reserve volume or residual volume. The vital capacity is higher in athletes, mountain dwellers than in plain dwellers. Why? It is higher in men than women and higher in young ones than old ones. Why? Because forceful inspiration and expiration is done often and their lung total capacity has increased than normal ones. The pulmonary volumes and capacities are about 20 to 25% less in women than in men and they are greater in tall persons and athletes than in small and asthenic people. Partial pressure of gas in the pressure it exerts in a mixture of gases. It is equal to the total pressure of mixture divided by percentage of that gas in the mixture. Means partial pressure of a gas, if to measure in a mixture of gases, it is equal to total pressure of that mixture divided by the percentage of gas in that mixture. How much is that gas in that mixture divided by the total mixture of gases?